Mental illness refers to a wide range of mental health conditions that affect your mood, thinking, and behavior. They can take on many forms and can affect anyone just as physical illnesses do. The Center for Addiction and Mental Health report that 1 in 5 Canadians experience a mental health or addiction problem, while 1 in 2 will have had a mental illness by the age of 40. Although people at every age can experience the effects of mental illness, young people between the ages of 15 and 24 are more likely to experience mental illness than any other age group. It is no coincidence that this is the age bracket that corresponds to a person's time in university. In an article by the CBC News, it was said that 65% of students reported experiencing overwhelming anxiety during school. 46% reported feeling so depressed that in previous years it was difficult to function. 13% had seriously considered suicide, while 9% had attempted suicide in the last year. Western University is not immune to the effects of mental illness. In the past year has had lost multiple students as a result. Western University has done a lot of campaigns to promote the mental well-being of its students and working towards ending the stigma. But many students are still struggling with their mental well-being and have yet to find an outlet where they can seek help as soon as possible. With month-long wait times, we have found that although Western is continuously working to try to end the stigma, they have yet to find a proactive solution in helping students long-term.
So I'm an RN at Parkwood Institute Mental Health. I work with typically with psychosis clients for treatment and rehab. So our tasks really entail, our job really entails anything from psychosocial rehabilitation, which we do on a daily basis, medication administration, and building those relationships, and having clients go from really severe symptoms to symptom management to eventually reintegration into society. Yes. As the more we learn about mental health, the more we find out that there's a very large biological component. Much like other disorders such as heart disease, it is a chemical imbalance, this time affecting a different organ, the brain. And so depending on the disorder, you have different neurotransmitters. So for example, 5-HT or serotonin is responsible primarily for depression. If you have too little serotonin, you start experiencing depression or depression-like symptoms. The university setting does tend to create moments of crisis that can lead to mental health disorders.
Yeah, so Western, I would say, has a lot of different services, and whether that be the Student Development Center, Student Health Services, the Peer Support Network, there are a lot of different ways to access help. The biggest problem I think we have at Western is understanding what resource you should be asking for given your current circumstance. So whether that be medical reasons, accessing SHS or student health services, versus if you just need to talk through something or get a psychologist and then going to SDC to get that kind of resource.
Yeah, so my role here is just to listen to students express their needs and try to get a better understanding of what they're going through so we can direct them to the services that might be best for them. And we also help to plan and organize wellness initiatives and activities for students on campus.
For example, at the Peer Support Center, students can come in and talk to us, and if it's a more serious issue, we can refer them to an appropriate resource. For example, that could be psych services where they can take over the problem and deal with it more professionally.
Stigma surrounding mental health on campus that prevents a lot of people from talking about it, from reaching out and getting help.
So I definitely do still think that there is a stigma pertaining to conversations about mental health and mental well-being, but I do think we're getting better. And over the past couple of years, I think we have noticed that our peers and even younger people are more prone to talk about mental health and mental illness, but also to ask for help. So now I think we're getting to the point where, like, once we ask for help, do we know how to respond? Do we know the answers, and do we know the supports that are available for all people, including students?
I would say anxiety related issues. And students don't even necessarily know that they're experiencing anxiety, but that's affecting a lot of students, I think.
I have been affected by mental health. I myself have suffered from various mental illnesses, from OCD to panic disorder, generalized worry, and social anxiety. And a lot of my friends have also dealt with depression and various other mental illnesses. I think the main contributor would probably be pressure from outside sources. So I think a lot of Western students struggle because of their parents' pressure on themselves, and they try to be perfect all the time, and for that reason they don't reach out for help.
So one of the things as students that we often are faced with is stress, and I think that's a very normal part of being a student. However, I do think that we need to focus as an institution and as a USC to figure out what are some preventative measures, and how are we focusing on our well-being as a whole, so we can look at proactive preventative measures so we don't get to the point of complete crisis. Stress is normal, but we still need to be able to address the levels of stress and how to cope with that, and provide the necessary supports for anyone who's in distress so we don't reach that level of crisis.
I do not think that Western addresses the mental health issue successfully. I think a lot of the focus is on ending the stigma, and a lot of it is not actually on getting help for students that request help or that need help, or making those resources available to students. I think for one, Western definitely needs a fall study break to have a week where students can take a break from their studies, and not just a 2-day period around Halloween where they'll just be partying. I also think that we need shorter wait times. It's definitely a huge problem, and academic accommodation definitely needs to be a lot easier for students, as well as advertising different services for students so that they don't need to spend that much time reaching out and trying to get help, and then just shorter wait times in general so they can get help.
I think they have taken some steps to improve student mental health. Like the Wellness Education Center is a great resource for students because it kind of prevents them from getting tossed around offices that don't know how to help them. We can kind of try to figure out what resources would be best for them. And the USC right now is working with the CMHA to bring in a crisis support worker, which I think is really great. And I know Western's done a lot of other things that's working towards improving student mental health, but I think we still have a long way to go.
I definitely think that one of the main things that we need to do is listen to our students and really hear their concerns. I think we need to do a better job of educating students on what the resources are and which resources to contact if you are struggling, and what your struggle is and which resource to access. Because we have so many things that we could possibly go to, it's sometimes hard to differentiate which one is best for you at that time. So if we could kind of do a better job of educating students on which resource is relevant to them at that time, I think that would be great. So the USC has a very strong stance supporting the Fall Reading Week. We do have 2 days, but we really think that if we were able to cut down on 2 of the institutional teaching days we have per semester and move it from 62 institutional teaching days to 60 institutional teaching days per semester, we would actually be able to clump it in with pre-existing holidays like Thanksgiving and be able to provide a full week. And I do think that would provide an opportunity for students to use that time as they need, whether that be for studying for exams or even just taking some time off to unpack some of the stressful times of university in the first couple of months, but also preparing themselves for the rest of the semester. Yeah. So I'm super proud of both Ali and Jamie, who are part of the USC executive, who have kind of made this collaboration happen. So in a brief Coles note, it's essentially a partnership with CMHA that is allowing some of their crisis counselors to come onto our campus in times of need or distress, in particular during exam time. So the next couple of weeks we'll have additional crisis counselors available for students at times of the day where usually most of the services on our campus are closed, so in the evenings, we really think that that'll be able to help students at least access the help they need if they do need it at that time of crisis. I would say the first tip is just to know that you're cared about and that you're here in a very stressful environment, and that it's totally okay to feel the way you feel. That there are so many people around you who are willing to listen, but you do have to try to help them help you. So reach out, and even if it's just having a friend take you to, say, the peer support center to talk through a couple of things, I would say that is a great start, and you should be very proud of yourself, even if you're able to kind of disclose some of the struggles that you're having with at least one person. The little steps are super important, and for every little step you take, you should be extremely proud of yourself.